Many people approach me with some common concerns or doubts. The youngsters, the newly married persons, they come and complain to me, Doctor, I was expecting sex to be great. It is nowhere near what I read in books or see in movies. When we examine them, they have no health issue and they are able to perform sex in a regular manner without any difficulty. But they think something is wrong with them because they expect what is described in the novels, in the Mills and Bones, whatever novels it is, or Harold Robbins novels. And that will not happen in real life. So they feel disappointed and feel something is wrong with them. The second group, people who are middle age and elderly age group, they are worried that their bodies are not able to respond as it was responding in the earlier age. Like you have people who are 60 years, they come and complain to me, Doctor, I'm able to perform, but it is not like when I was 16 years or 20 years. Imagine how can it be at 60 as it was in 16? They admit that they cannot walk as fast as a 16-year-old or 20-year-old. They cannot climb stairs as quickly as a 20-year-old would. They cannot run like their grandchildren. But when it comes to sex, they want to be like a 16-year-old Balakumara. How is it possible? What they should realize is, as we age, which is inevitable, our body slows down. It doesn't rob us of our sexual prowess, but our response slows down. Earlier, when you were young, a man can get an erection only by a visual stimuli, seeing a naked woman. At 60, he is still capable of getting an erection, but he requires intense physical stimulation by his partner. The erection will not come automatically and quickly. But they don't get that, but they are worried it was not like when they were 20 or 16. It's natural for body to slow down. The response will be slow. Newly married couple, they read novels like Betsy and other things. They expect stars to shine and intense fireworks to happen, and the sex should culminate when they get the climax or ejaculation, like in a technicolor or multicolor video and audio. That doesn't happen. So they think something is wrong with them because they are not getting what they expect. Again, many people see the blue films, watch the blue films, and they come and complain, Doctor, my wife is frigid. She is not responding as I seen in the movies. These men expect their wives to respond the same way the actresses in blue movies act, emanating the same sounds, showing the same sensations, and shouting and screams. How is it possible? All that people should realize is that they should not have unrealistic expectations. It's okay to have expectations, but it should be grounded based on reality. If your expectations are unrealistic, what happens is if it doesn't match with your expectations, first the persons get disappointed, then get upset, and then gets angry, frustrated. That will tell on the marital relationship and on their life. They should be able to be mature enough to distinguish between a real life and a real life. Take, for example, if you see a hill station in a movie, Take Ooty or Kodaikanal or Simla, Kulu, Manali. They look very colorful, but when you really go there, it won't be as colorful as when you saw it in movies. Because in movies, you have color filtered lens that will capture the beauty. And second thing, in the movies, the hero or the heroine on impulse will start singing and dancing. Is it possible in real life? So, friends, please tell your friends, whoever is concerned, that nothing wrong in having expectation, but it should be realistic. That's very important. They should become mature, and you teach them to be mature, guide them to be mature, and have to distinguish between a real life and a real life.